Good morning, everyone. I'm Dr. Richa Saxena, an obstetrician gynecologist, and today we shall be talking about polycystic ovarian disease or the PCOS. This is a disease commonly encountered amongst women worldwide, and it affects nearly 5 to 10% of female population. And it specifically affects the women in their teenage as well as in their reproductive age group, that is between 25 to 35 years of age. And it may be commonly associated with abnormalities such as menstrual irregularities. There may be anovulation, infertility. There may be presence of excessive body hair. There may be presence of acne. There might be thinning of hair resulting in male pattern baldness, and so on and so forth. So what exactly is happening and what is resulting in the symptomology of this disease? So let's see. Now this is a normal female, and you can see that here this is the pituitary gland which is present at the base of the brain, and this is the master gland which directs the functioning of all the other glands in the body. Now this is responsible for producing two main hormones which control the functions of the ovary, and these hormones are FSH, which is the follicle stimulating hormone, and the LH or the luteinizing hormone. So under the effect of these two hormones, you can see here this is the uterus, the fallopian tubes and the ovary. The ovaries, they will result in production of a follicle which grows and eventually it ovulates. And you can see here that this is what is happening in the normal ovary. Under the effect of FSH and LH, a female hormone known as estrogen is produced, and this causes the growth of the follicles inside the ovary. So you can see here this is this tiny follicle, and this starts growing, and eventually the growth occurs. It becomes large enough, and then it becomes so large that the wall of the follicle eventually ruptures, and when the wall ruptures, the ovum which is contained inside, it is extruded out. And this is the process which is known as ovulation. And then this ovum will pass through the fallopian tube, it will travel via the fallopian tube into the uterine cavity, and this gets implanted here into the endometrium. So this is what is happening in a normal case. Now what happens in case of a polycystic ovarian disease? In this case, what basically happens is that there is an imbalance of hormones which are produced by the pituitary gland. So, excessive amount of LH and low quantity of FSH. Since there is this imbalance, the stimulation of ovaries cannot occur properly. And when the ovaries are not stimulated properly, what happens is, instead of this happening, that is, instead of one follicle growing and resulting in ovulation, what happens in case of PCOS is growth of multiple follicles occur simultaneously together. So since multiple follicles are growing, none of them reaches a size where the wall can rupture and the ovulation can take place. So no ovulation is occurring, and eventually what happens is that these multiple follicles, they will collect some kind of fluid and they develop into cystic structures. And this results in this kind of appearance of the ovaries, which is the polycystic appearance of ovaries. So this is typically seen in polycystic ovaries. And now because of this cystic structures, no ovulation is occurring. Because of the hormonal imbalance which has occurred, there is excessive amount of male hormones or androgens which are produced, and this results in excessive body hair, acne, and other problems. Now, is there a cure? There is no cure per se for polycystic ovarian disease, but we have medicines which help reverse the symptoms. So there are medications which will help resume ovulation in the women, or they will help deal with the menstrual irregularities, or there are also medications which will help stop the growth of excessive body hair. So that was all for today, and in case anyone has any more questions related to PCOS, you can please put it in the comment box below. And that's all for today. Thank you for listening. Bye. Take care.